Hello, welcome everyone. So today we will learn about the topic named rapid maxillary expansion. Rapid maxillary expansion is also known as split palate or rapid palatal expansion. It is a very important topic in orthodontics. So it is a skeletal type of expansion. Remember the name Emerson C. Angel. He is the father of rapid maxillary expansion. So now we'll first learn about the anatomy of the maxilla. We know that maxilla is made up of two bones. It is a paired bone which articulates with other bones in the face, in the middle third of the face. It has a mid-palatine suture. So this mid-palatine suture, which is present in between, which joins the palatal shells. So this mid-palatine suture will be split in mid rapid maxillary expansion. So when we split this suture, it will help to increase the space, and it will increase increase the size of the maxilla. So rapid maxillary expansion should be done before the ossification. If this ossifies, it is not possible to undergo rapid maxillary expansion. So we have to undergo rapid maxillary expansion before the ossification, that is during the growth periods, early pubertal growth periods. Rapid maxillary expansion is done. Indications of rapid maxillary expansion. First is posterior crossbite. So we'll divide into two parts: dental and medical indications. So in dental indications, you have posterior crossbite, you have undersized or narrow maxilla. So if your maxilla is narrow, we can increase the size of the maxilla. Posterior crossbite also occurs because of the narrow maxilla, most of the cases. Then normal maxilla, if the maxilla is normal but the oversized mandible, to compensate for the oversized mandible, you can expand the maxilla. The next is cleft palate patients who have collapsed maxillary arch along with reverse pull headgear. So reverse pull headgear, it's a face mask appliance. So this face mask appliance which is used here, it's a rod shaped which is placed in front of the face. So we can use rapid maxillary expansion along with reverse pull headgear. So what are the medical uses? Medical uses is because when due to narrow collapsed maxilla, the nasal airway space decreases. So you might have nasal stenosis, poor nasal airway, septal deformities, and recurrent ear and nasal infections. So in these conditions, you have to undergo rapid maxillary. You can undergo rapid maxillary expansion to increase the size of the maxilla, thereby increasing the space of the nasal cavity. So let us see how to diagnose a case of rapid maxillary expansion. First, you will take a through case history, then you will do clinical examination. Clinical examination help us to view that the maxilla is short, maxilla is collapsed. Then you can see through radiographs, you can see the ossification of mid-palatine sutures. So this can help us to diagnose. So first we have learned about what is rapid maxillary expansion, the father of rapid maxillary expansion, the anatomy, indications, diagnostic aid. Now we learn about the effect of rapid maxillary expansion. First, what effect on maxilla, maxillary teeth, mandible, and nasal cavity. So when we put once the rapid maxillary expansion is fitted onto the patient, we will see effect on maxilla. Maxilla is a bone. In the bone, what you will see? Opening up of the mid-palatine suture. So the suture, mid-palatine suture, this suture starts opening up. Here the suture gets opened up like this. So this is the space that gets created. Opening up of the mid-palatine suture. Because of the opening, you have downward and forward growth of the movement of the mandible. Not growth, it's a movement of the mandible. First, this is the mandible. Sorry, actually it's a downward and forward movement of the maxilla. So the maxilla moves downward and forward. So the maxilla moves downward and forward, downwards and forward. Thereby this also increases the space of the nasal cavity. Effect on maxillary teeth. If you can see, the palatine is, this is the mid palatine suture. If this separates, you can see there is a space between the two incisors, two maxillary central incisors. You will find a space, and posterior teeth show buccal tipping and extrusion. Because the maxilla is expanded from both the sides and this forward growth, the buccal teeth, but the posterior teeth shows buccal tipping. It tips buccally and extrudes from the occult, thereby increasing the arch size. Then you have mandible. Effect on mandible. You have downward and backward rotation of the mandible and increases the face of the height. So because maxilla is also moving downward and the mandible moves upward and backward and upward, you have increase in the facial height and reduction overbite. The overbite which was there before, it decreases. Effect on nasal cavity. Have reduced resistance to radial effort. With the resistance which was there before because of the narrow nasal cavity is now reduced, and now it's increased airflow and increase intranasal space. So in this video we have learned about rapid maxi expansion. In next video we'll cover about the appliance that is used for rapid maxillary expansion.